I want to welcome everyone to the latest version of the VIA Live Product Training webinar series. And we're thrilled today to have the team from MTTS on to talk to you about some of their respiratory devices. Before we get to that, I wanted to just do a quick introduction to VIA Global Health for those of you that are new to working with us. So what we are is a medical equipment sourcing platform where you can source, quote, purchase and ship products from around the world directly to your door, any country. Our real focus is to make it fast, easy, and affordable for you to find the products you want. So it's all about creating awareness of those products and creating access for you to receive those products. So I'll take you just quickly through the website so you have a more familiar look as we're going through the webinar itself. So obviously, we start with the most used feature, which is our search bar. So you can search for any products from our thousands in our catalog. You can look at certain categories here, or you can shop all. You can look up a little bit more about us as a company, so you can build that trust in who we are. We also have buyer's guides, which I'll show you in a moment, which are a guide to help you understand how to purchase the products you're looking for. So a little bit more information to help you in your search. A little bit more information about where we are and what we do. So that actually that number is a little bit higher now because we had a few new countries come on in the last few days, but over 60 countries and over 1.5 million patients impacted in this work that we're doing. Some of our testimonials I can take you through, and then of course MTTS Impala is there that we're going to go through. So the first page I'll show you is the About Us page. So this is something you'll just be able to learn more about who VIA Global Health is, what we do, how we work, who our customers are, and generally what we do. So there's more to us than just a product catalog. There's everything from sales and support and customer service to logistics to market insights and product training, which is exactly what we're doing right now. So we try to always keep you informed and keep new services available to help you in your search because we know there's quite a few challenges. So that's the first page I'd like to show you. The second is our testimonials. So this is just customer feedback. So we can tell you how great we are, but we'd prefer to have our customers tell you the same thing because it's more important for our buyers to give you that support of who we are and what we've done. So from a standpoint of just our honesty and strong relationships, are helping our buyers to grow their businesses, obviously some pictures there to show that, and then reliable deliveries and positive impacts, because as much as we're about selling products and creating deliveries, we're all about creating impact to improve health outcomes in communities. So a little bit more here, if we go to our navigation on the site there, if you just click on that little hamburger icon. So there's a few things you can find here. Obviously the About Us page we went through. We have an FAQ, frequently asked questions. So if there's any questions you have about how we function, how our quoting process, how many years we've been in business, anything in particular, you can find that there. You can again find our testimonials here. Our latest news, so if there's any new announcements, like any new grants we have, or we've been featured in any publications, or we've reached a new milestone for patient impact lives, that's something that would be featured there. And then I'll take you just the product training. So obviously when we do these webinars, these are things that you can find the videos live, but you can also find the videos after the fact. So if there's any trainings we've done, you can find them all here for all the products we've done. This is a little bit more what I had mentioned about the buyer's guide. So you go to buyer's guide, and then you just down there. You can see COVID-19, newborn jaundice, quite a few, and we're adding more each day. So come back and check week by week to see which new ones we have. You can see here it's all about informing you about what the products do, how to find the key features, and make an informed decision for which product is best for you. So you can go through here, and again, you can look at things like ventilators, which we're going to go through one today, resuscitation devices, things like that. So again, it's all about creating services that help you find products and create access more easily. I'll just jump in now quickly to the shop page. So of course, you're here to find products and to get quotations and to make purchases. So the easiest thing that most people do on the homepage or throughout the site is the search. So you can search for Impala, and then you see obviously those products pop up. You can use more general terms, of course. You can search the word cannula or oxygen, and you'll get all those things. But of course, you have those recommendations, or you can just click that magnifying glass and it would bring up all the results. Some other things you can do is on this shop page, which has all of our products that would just continue to load as you go. That would be a bit overwhelming, of course, because we have quite a few products, over 1,000 products. So what you can do then is filter. So if you wanted to just look at things like respiratory and intensive care, you could click that and it would just drill those products down to what you're looking for. You'd see the ventilator there, the Impala. So that's the kind of search feature. But I want to talk to you quickly about the products we're going to go through today, and more just about how you find quick and easy information on these. We're very much about transparency and information sharing so that you can find everything you need to know about this product. So you can now see the images of the product. You can see any of the kind of short description here, quick bullets of important information of kind of where the product's coming from, what is the warranty term, regulatory approvals. We know those are very important for our buyers. Then you can go through the page. It's as organized as possible for descriptions, key features, specifications, standard accessories, but also optional accessories and add-ons. In some instances, those are links where you can go to the product page for those specific products as well. And then, of course, we know extremely important is those product documents, whether it's a manual, warranty policies, sometimes that might be a specification sheet, as well as regulatory certificates. And of course, we have videos. So once this webinar is finished and we finish the video, we'll also load that video onto the product page so you can come back and look at the Impala ventilator webinar if you missed it the last time. So a bit more here about FAQs, package contents, warranty. Again, it's all about giving you everything you need to know. So you're not waiting for us to get back to you. You're not wondering certain details. You can look specifically here about package contents and know exactly what's going to come in your package. So that's important information there. That is the Beluga Resuscitator. So again, the same idea, all the information you need is there, and we want to make it as fast, easy, and affordable as possible. If you do want to request a price, obviously we just click this button here, fill out your basic information, and someone from our sales team would follow back up with you. So without further ado, I don't want to talk anymore. I want to let our product expert talk you through a demonstration. We will have an opportunity to take your questions. So the one thing I'd like to do is just introduce you to that software for the GoToWebinar. So you can see a section there that says questions. At any time you can type in a question. We won't get to those questions until after the demonstrations, but we really encourage you to ask those questions. And we want to hear from you. This is an opportunity for you to make your voice heard and really get to know the exact answers to the questions that you have. So without further ado, I'd like to introduce you to Greg Dyer, who is the product expert at MTTS, who can take you through the Beluga.
Beluga bases on a similar platform to Impala, a simpler device. But my plan is to open that for you on the back so you basically can refer for the maintenance, preventive maintenance, Impala and Beluga together. Beluga is a portable device. It can be used in the ambulances, can be used also in together with resuscitation stations. We provide it together with the bag, so you can use it directly from the bag. It has it's a resuscitator, so used for most of the time for emergencies. And the bag itself has two ports. One where we can connect the tube, breathing circuit with the T-piece, which we provide also reusable or disposable, but we do provide reusable, which is also makes the customer independent. So I connect it here. It's going to be easy to do it this way. And to the T-piece, we connect the silicone mask, which comes in 3 different sizes. So I'm using the size 0, which is the smallest one at the moment, just for presentation. So this is the setup. That's it. Later, I'm going to open the bag, but I just want to show you how simple it is, because it has to be used quickly. Now, turning on is here on top, so I just turn it on for now. Let's make sure. Now, you can see the screen, I hope. And the device is much simpler than Impala and very easy to use. I'm just choosing the rates per minute, breaths per minute, first choice here, and oxygenation, breaths per minute, we can adjust to, let's say, 30. Oxygenation, this device can be connected to oxygen. I don't have it here, it's not connected now, but when necessary, especially in hospitals, it can be connected to the oxygen. And final choice is the PEEP and PIP, PEP and PIP. So here I set for 20. Yeah. And PEEP is the PEEP we regulate by this knob here. So we choosing what needs to be done. So then I press against the table to get the no leak. And now when the beep tells you how often you should close the flow here. So now we're providing resuscitation, 30 beats per minute with the settings of 5 and 20. I'm not a nurse or a doctor, so I'm not perfect at it. The beep helps me. The nurses and doctors are trained, so they don't need that assistance. If they don't need that assistance, they go to functions and they can just turn it off if it annoys them. So these are the additional functions you can adjust. You can rotate the screen, you can set the volume of the sound that we create, and also the metronome on and off. And very cool function is here also that we can use the device in different positions. So if I turn it upside down, the screen also rotates. And now, for that reason, I would like to take the device from the bag and move from the bag. And that device looks like Impala, the same box, much less functions. And the device can be used in the horizontal position or the vertical position for convenience. Here's the port for the oxygen, AC port, oxygen port, on-off button, and our connection to the TP set. And now I would like to, I will turn it off now, because one important thing I need to share with you is the maintenance, preventive maintenance, or any access to what's inside the device. In Beluga and Impala look exactly the same when you open the back panel here. I use the standard screwdriver. They look exactly the same. So 2 screws to make sure that nobody else access that except authorized personnel. And inside here, this is what I was talking about previously. You have batteries, 6 batteries, and they last for, in both cases, they last for minimum 4 hours. So if there's a power cut, 4 hours, the device is going to keep working. Oxygen sensor, this one has to be changed about every 2 years, depending on the use and the oxygenation levels. FiO2 settings provided, set by every user. It can be longer, can be shorter, but we provide those oxygen sensors as well. They are small and easy to deliver. And the filter. So the filter, typically 6 months, but can be longer or shorter as well. It's very light and easy and cheap. We're providing them as well, if necessary. And then It's that simple. So access, very clear access. We strap it for transportation. Later on, can be open. At the moment, the batteries are strapped to make sure they don't fall during the transportation. But after that, they don't need that strap here at all. So as you can see, the device is very easy to use and easy to maintain. And that is everything I want to share with you. So please ask questions if there are any.
Fantastic. Thank you, Greg. That was very informative. I think actually a lot of the questions that were asked were answered soon after they were asked. So I think quite a few of our questions are already answered, so that's quite nice. So we can jump into Beluga now, and then there's a few other questions that are more general across both products or across kind of the company specifics. So for Beluga, just looking through quickly, we'll see that Impala is mounted on a stand. Can it also be mounted on a stand, the Beluga?
Yes, definitely. It's the same box, the same attachments. Usually they are operated in this position for with infant warmers or incubators. However, facility is there. Can be in the back, the stand, and just as a standalone unit. Yeah.
Perfect. And I know you had quite a few questions that I know you did answer with the battery backup for 4 hours time. There's a few questions just on the charger though. Is it the same as the charger with the Impala?
Yes, it's exactly the same. Power management in both cases is exactly the same. So we're talking about 4 hours battery backup, and charging back from 0 to 100 is about an hour and a half.
Okay, perfect. And again, another similar question to the Impala, but for Beluga, for neonatal use or adult only?
So this is the opposite. Beluga is for neonatal and pediatric, although can be for adult as well, for adult resuscitation. It's all about the maximum flows and pressure we can provide. So in this case, Beluga is easier because it's resuscitation only and it's a short-term therapy. And heat and humidification is not required in that case. And when we talk about ventilator, CPAPs, we're talking about days of therapy, maybe weeks in some cases. Then that providing heat and humidification to the gas is critical. While for resuscitation that lasts minutes, maybe a couple of hours, maybe longer, this is not critical parameter. Then we are very flexible in Beluga. We design it for neonates and pediatric use, so we can see it from the selection of sizes for masks. But there's nothing against going that for adult care as well.
Okay, fantastic. I know that was also a very thorough presentation. So a lot of the questions that were asked, again, related to accessories and battery backup were already answered. So I'm not going to ask those again. So I'll jump just quickly into the more general. The few people are now looking at the product page and they're seeing the regulatory approvals. And there was just a question about whether you're also looking to add CE mark.
Beluga is a little bit different story. Beluga, we decided not to go for CE mark yet because we have PCA certificate already and Vietnamese certifications done. PCA certificate includes also the same tests as for CE mark, so we have all the test results from accredited laboratories. So we didn't decide to go for CE mark for Beluga purely for commercial reasons. We just don't want to spend that much money for something that we don't think we're gonna sell in Europe at this point of time, at least. And it's a perfectly fine device from regulatory point of view when you look at the test results and actually being used in many places already. Beluga was commercialized before Impala, so Beluga has been around for almost a year with all the certifications, and we sold it in hundreds of units.
That's understood. Okay. So that is all the questions. There was just another one as well about technical support. So whether or not folks could reach out directly to MTTS. So for that, I would say any of the folks that have technical questions, specifically for those who have already delivered the product and have it in hand, just connect directly with your sales representative, and we're happy to coordinate to have someone from a technical side answer any questions directly. But we do ask that you go through VIA so that we're not inundating MTTS with requests for that, especially when they're not familiar with who the customer is. So for any technical assistance, again, any quotations, a few other questions have come up about quotations and spare parts, things like that. We encourage you to go to the product pages that I'll bring back up again here for the Impala and here for the Beluga. If you just request the price there, we'll come back to you with that. If you do want to just ask an open-ended question, you're welcome to email us at sales@viaglobalhealth.com. And somebody from our team that's assigned to your market will come back to you as soon as possible. So it looks like that's all the questions. Greg, is there anything that we maybe didn't touch on that you wanted to mention?
Only one thing about the technical assistance is we have good experience with providing remote assistance, and availability of spare parts is always assured. And I think our strong point as a company is to quickly react to all the requests and take everything seriously. In very remote locations, as you, Brian, know, that we cooperate together for a while now.
Perfect. Well, Greg, I really appreciate your time. I know it's not a bad time for you, but for some folks on the line, it's very early or very late. So I want to thank everyone for your time and joining us for the latest VIA Live product training series. And Greg, thank you for your time, and everyone joining, thank you for your questions, and we look forward to seeing you next time.